So they've really expanded their roles. Now that we're entering these formal agreements with health systems, pharmacists are now being able to integrate directly into physicians' office, and they play a much bigger role. Since we're holding them accountable for costs, for quality, pharmacists are really in a prime position to help patients succeed, help the agreement succeed, and help their health system succeed. So as we get further along in these agreements, we start small. We might work with 1 or 2 pharmacists that are hired to help control costs. But as they're starting to see the value, it's now becoming much more systemic. They want to hire more pharmacists because they see the value. They see what they can do beyond just changing medications. They help with adherence. They help with cost questions. They really help fill some of the needs that a physician has given their workload. So pharmacists, they know medications, they know the ins and outs, they are able to understand insurance, they can have better conversations with patients, it's their job. And so now that they're really able to use these skills through our ACO agreements, they can really start to shine. They can show the value that they bring, where it's not just dispensing drugs, it's not just handing them out to patients, it's making sure that they're able to take it, that they're able to tolerate it, they can afford it, and addressing any barriers that come up. It starts off small, where we address simple issues, but it makes a difference. It saves patients' lives. They're taking their medications like they're supposed to, and they will have better health outcomes because of it. By doing what's right, by addressing all the patient barriers, and by making sure that they're able to take cost-effective medications, that they can afford it, we're able to see long-term health outcomes. They're avoiding those inpatient admissions, they're avoiding those potential heart attacks, those other crises that happen when patients don't take their medication. By working directly in the office beyond the capacity of working in a pharmacy, they're able to have those relations with the patients, establish that trust, and really drive change.